Hi there, my name is Dr. Quinlan and I am a PGY5 Neurocritical Care Fellow here at Johns Hopkins.
And my name is Vishal Shah, and I'm a neurocritical care attending as well as the program director for the fellowship at Johns Hopkins.
Yes, he is. And we are here to tell you a story of hope about a patient of ours who had autoimmune encephalitis in our unit. So please
enjoy our story of hope. All right.
Okay. All right. This is Esther Ung. Esther Ung is 19 years old, and she came to our unit after she was experiencing progressively worsening behavioral symptoms and some URI symptoms and new onset seizures that were very difficult to control. She came to us and tested positive for an anti-NMDA autoimmune encephalitis. And stayed with us in our ICU for over a month and stayed in our greater hospital system for over a few more months. She was in a coma during her time with us and had very refractory seizures. She's here today to tell us about her experience with coma and with coma recovery. Esther,
yes.
Tell us a little bit about yourself and tell us about what you did before you were hospitalized.
I was from kindergarten to 12th grade graduation. I went to an international school. There I was since I was young, I was very exposed to many diverse cultures. And in my junior and senior years, I took the International Baccalaureate, and I received my IB diploma. And after that, I was admitted to the George Washington University, where I was a dual major. I was taking international business and political science. However, not long after I was attending college, I suddenly got sick. At first, we didn't know what disease I was having. It was all very scary, and I ended up at Johns Hopkins.
That's right. And tell us about what you remember when you started waking up out of a coma. What are the types of things you remember? You told me you remembered opening your eyes and seeing drips of medications and things. What types of stuff do you start? What are your memories that you have as you start to wake up?
The first time I woke up, my memories were not fully there. I woke up and I felt my soul, my consciousness was back, but I was having trouble. When I first woke up, I actually didn't know why I was in the hospital. I completely lost my memory. So I actually gained back consciousness, but I didn't really remember much. So when I first woke up, I looked around my room. It was a dark room and no one was there. I looked around and I saw medical drips, but the drips were, I don't know if I was hallucinating, but I don't think I was hallucinating, but I saw the medical drips were decorated in gold ornaments. I'm not sure if that was real, but I saw that, and I'm sure it was at Johns Hopkins because I looked at the heart rate monitor and it was the same heart rate monitor as my other rooms. So
Yeah, I don't think it was the gold ornaments, but it can happen with the medications. Do you remember hearing people talking to you? You may have had a tube. Do you remember that in your mouth, in your throat?
I don't remember having tubes in my nose and my mouth until I saw pictures of me. After I fully woke up and my family visited me and showed me pictures, I only noticed I had like tubes then. But then when I woke up, I think I already had the trach in.
Okay.
I was super annoyed with that. I was so annoyed. I hated it.
Do you remember hearing, so you were here around the holidays, so there was a tree outside your room, right
Really?
where you were. There was a Christmas tree that started to be outside your room,
Oh.
but I don't know if that's what you're remembering. And do you remember hearing voices or hearing nurses talk or doctors talk about you? Do you ever feeling like you heard sounds or noises or anything?
Actually, when I first woke up, I actually didn't hear anything. It was all very silent. After, like, I think after a week I woke up, my family got here, but I actually didn't hear them talking to me. I think they were talking, but my my senses weren't really there. So I didn't really hear anyone. It was all very silent. But
you remember seeing your family? Because I remember your father was always there in the room by your side.
I saw people, but I didn't hear people. I didn't hear anything. Yeah.
We wanted to also. So yeah, how did it feel to see your family there? Did that give you comfort at that time to see that they were with you and you were by your side?
Yeah, actually, when I first woke up, I saw I remember my friend came in to decorate a poster for me with like my photos and fun facts about me. And when I first woke up, when I first woke up, that wasn't there. But the second time I woke up, it was I saw the poster, and I woke up, and at first I was kind of confused. I was like, is that me? Are those photos me? I couldn't really read the words that was written yet, but gradually as I got better, I was able to read a little bit, and I was like, oh, that's it's so sweet that someone decorated this for me, and I felt taken care of. I saw my family, and all of that kind of helped me recover fast, because I had a lot of good emotional support beside me.
You did. You had a lot of visitors and a lot of people who loved you visiting you.
Yeah.
And you also had a lot of our staff who have, just been championing for you and rooting for you and watching you recover. And as you walk through our unit now, you're quite a celebrity. You can see how many people are so happy to see you and so happy to see your recovery.
And then after your ICU stay, you said you went upstairs to the regular floor. Do you remember your time up there?
Yes, that I remember almost all of my time there, because I was fully conscious then. I remember most of my nurses there. In the ICU, because when I was in the ICU, I was kind of in and out. I was conscious for a bit, and then I would go back to sleep, or I would pass out again. So my memory was like in and out. So I remember some parts of the ICU, but not all.
Like what? What do you remember?
I remember seeing like the posters and some. Oh.
You mentioned music.
Oh yeah. Oh, I remember being played Billie Eilish.
Yes, we played you, Billie Eilish and SZA, and we played you. We always asked your family what your favorite music was, so we tried to play you hip and fun music when we examined you.
I remember also on the poster, my friend wrote down my favorite artist, so I reckoned you guys saw that and decided to play the artist there.
During your hospital
stay.
I
do remember that.
Yeah.
Wow.
I don't remember all of it, but I can like recall some bits. But then compared to my time in the 12th floor. There I fully gained back conscious, so my memory was fully there. There they also started giving me like a little bit of therapy too. They made me like walk over to the chair, or like, oh, they gave me chocolate pudding there. That was, yeah. Upstairs, I was much better. So we got to do some fun stuff upstairs. Back in the ICU, I was really sick, so it was all like all the food was just tube feeds. That's what I do remember, all the tube feeds and stuff. But upstairs, they actually started giving me some real food.
Okay. Before we move to the recovery, is there something that you think could have been better or more done differently while you were in the ICU or on the 12th floor?
Well, there's many good things to say about my stay here. Dr. Miriam and many other doctors, they did a very good job taking care of me. I felt very cared for. Every time, I remember, well, I don't have full memory of it, but my family and friends, they all told me that every time I needed something, everything was fulfilled. All the doctors, all the nurses, they were here for me. They were here for me all the time. Every time I needed something, they knew what to do. They had everything on hand in case of emergency. They made sure my life was like they made sure I could make it through and survive, and I'm very thankful. I guess I'm thankful for being sent to Johns Hopkins, the best hospital in the world.
Thank you very much. We're just so happy to see patients when you come back and show us how well you've done. It really helps all our team and everybody know that what we do in the ICU really matters and helps.
Tell us about your recovery. Tell us about, I know that you got a trach. Mm-hmm. And did you have a peg too? A tube in your belly?
Oh yeah, they call it the G tube.
Yeah, that's correct, a G tube. So tell us about what you remember about your recovery and what challenges you've had to overcome in recovery.
So after I got discharged from Johns Hopkins, I got discharged on December 10, and after that, I was transferred to Kennedy Krieger as an inpatient. Most of my recovery happened there. They're a great rehabilitation institute. There I had therapies from like 8 a.m. to 3 p.m. I was busy with therapy every day. And as an inpatient, I received physical therapy, operational therapy, neuropsychology, speech therapy, and some recreational activities. I had a pediatrician doctor with me, looking after me all the time. With physical therapy, all my therapists, they did a very good job with helping me, getting me back to as a normal person. As the recovery process goes, I recovered pretty well. Physically, I'm very well now. I am actually going to the gym every day. I'm not sure if you guys know, but it's called Orange Theory.
Oh, yeah.
It's at the harbor. Very good gym, very good trainers. I go to the gym every day. I'm getting back in shape. So physically, I'm completely fine. However, the only part of my body that's still recovering is my voice. As you can hear, my voice is still a little raspy, and it's from the trach.
How long after you left did they take the trach and the measured you out?
I think after like 2 weeks,
Okay.
I actually came back to Johns Hopkins to get it out. I came back to Johns
Okay.
Hopkins after like 2 weeks because they started to give me liquids to drink. So I had to go back to Johns Hopkins to get a X-ray scan to see how I swallow, and that went well. So I went back to KKI and they started giving me real liquids, and that went well. So I got my trach removed, and my neck healed, but it's just when I came back to meet I went to Johns Hopkins Voice Center to get an endoscopy in my nose to see what's going on in my throat. They saw that one side of my tissue I lost some bit of my tissue on the right side, and that's why my voice is like this. But I'm still getting speech therapy every day as an outpatient at Kennedy Krieger. So we're expecting my voice to improve with speech therapy. It's improving every day. When I first got discharged, my voice was super quiet. People actually really couldn't hear me. But now I'm talking and it's pretty good. It's just not fully there. So
Better, Esther.
Yeah.
So you came to visit us on the unit after
Yeah.
you recovered, and you came to see us. And that day that you came to visit us, I could barely hear you.
yeah.
And today, your speech is so much stronger and so much better.
Yeah, so with speech therapy at Kennedy Krieger, we do a lot of vocal exercises. So that's really been helping me getting my voice back. But other than that, as an outpatient,
While we're on the voice, so you said you really liked music. Would you sing before?
yeah,
Yeah.
I have. I used to perform in high school. I used to
Oh, wow.
perform. I used to dance and sing.
Wow. But I'm glad that your voice is getting better. So it looks like hopefully eventually you should get to a point where you can go back to doing that. And then before we move away from the trach part, when you had the trach and the peg tube, was that difficult to adjust to? Did you feel having the trach in your throat was painful, or were you having problems from that?
Yeah, so it's kind of funny because when I had the trach in, it was really annoying. I didn't like the feeling of it at all. And also, because my brain was inflamed and me personally wasn't there in the moment, I was really annoyed with the trach and I kept on trying to pull it out.
Yes,
And
you did.
yeah, and then my doctors and nurses were like, Esther, stop. And I was like, no, I hate it. And then I kept on pulling it out. And I remember getting handcuffed and foot cuffed.
Yeah.
Yes,
Yep. You
yes,
had
that's
restraints
right.
on you because you were trying to pull your trach out.
Yeah, and then I was transferred to KKI for one night, I think. And then there, I was super agitated. And I remember throwing kicks and punches at my BRAs. It was very bad. And they were also super confused. And my nurses in KKI, they were looking at me in the cameras. And they were like, Esther, what are you doing? It was funny.
We know you didn't mean it. They obviously
Yes,
didn't mean it.
yes.
Yeah, I didn't mean to do that, but I didn't really have control of my body. My brain was just making me do whatever.
Yeah.
It was.
And how long after being at KKI were you able to start walking? Do you remember roughly like how many weeks that took? Or?
Did you walk on the 12th floor before you went to KKI?
Yeah, actually I did. There it wasn't. I did have PT, but physical therapists, they came to see me, and they wanted to see how strong how strongly I'm recovering. So they made me like walk around the bed and like walk to the chair, sit on the chair, all like we were taking baby steps on the 12th floor. But when I got transferred to KKI, the next morning I got my physical therapy started. So my recovery was actually really fast.
Yes, that's great.
Yeah.
I had one more question about coma. You said that things were silent.
Mm.
What about, were things black? Like, could you describe, like, did your vision go black? Do you feel like, do you remember anything about when you were able to wake up again? You said your body, your soul, like you felt like your soul was going into your body. Like, do you have any more descriptions of what coma feels like? I know that it's a hard question.
Yeah, so while I was in a coma, I don't remember what happened while I was in a coma because, you know, I wasn't there. But when I woke up, I had a lot of trouble like recalling memories. So when I first woke, when I started being able to hear people talk to me, I remember that things would go in one ear and go out the other. So I had trouble retaining memory basically. So everything that my dad and my family would speak to me, I would hear them, but then I couldn't retain the memory. So I remember when I got my phone, I asked my dad for my phone password, and he told me my phone password repeatedly, but I couldn't retain the memory. So I remember one night, I threw a fit. I threw a fit at my nurse. It was a guy. He was freaked out. I was like, I don't remember my phone password, and I was like super angry. I threw a fit, and he was like, girl, who are you? What's going on? He had to like call up emergency. He's like, this girl's throwing a fit. It was crazy. Yeah, I had trouble retaining memory.
Do you still have any symptoms that trouble you?
I don't have like physical symptoms anymore. I can sleep well. I don't have insomnia anymore. The only challenge I have is I'm seeing neuropsych twice a week at outpatient Kennedy Krieger. Some things we noticed were that physically I'm fine, but some things my memory is a little affected. So there's some attention deficiencies too. So, for example, sometimes I would like walk into our home and I would forget to lock the door. So there's like some attention deficiencies that's still going on, and I kind of forget stuff a little bit. If my dad tells me to remember to bring this before I leave the house, I walk out the door, I forget it. Those are some things we noticed in my daily life that's still happening, but we're working on that with neuropsych. We're working on that. We're still recovering, and currently as an outpatient at Kennedy Krieger, they're working with me to get me ready to go back to school.
And what, do you have a plan for when you would like to resume school?
Yeah, I'm actually going back as a freshman next fall. So I'll be graduating a year late, but it's fine. We all take our paths differently, going at different paces.
Yeah, I'm just so glad that you recovered so well.
Yeah.
You're going to go back to school, so congratulations.
Yep.
Right.
At KKI, I also have an education specialist. They're also the educational team there. They're also helping me getting me ready to go back to school. And my therapist, they also work with me on college level stuff like writing essays and doing some university level work. So very thankful I'm sent to one of the best hospitals and rehabilitation centers.
Your family was just so concerned, and your dad used to tell me, all I really want, I want her to be able to go back to school. It's very important for me to go back to school. So Esther, it's wonderful to see that you're planning to do that.
Mm-hmm.
I want to ask you, what would you want to tell to patients and families that are dealing with severe brain illnesses and those that are fighting coma, just like you did? What are things you want to say to patients and families who are going through what you went through?
After experiencing very rare disease and surviving through it, I see myself as a stronger person. I know one of my seniors who graduated from the same high school as me. She also experienced an autoimmune disease, but she didn't make it. She passed away. She went to Boston University. She's also Burmese. We know she was our senior and she didn't make it. So seeing there's a lot of people who didn't survive similar diseases as me, it kind of taught me to not take life for granted. It's very sad to see many people that should have deserved to live, but they didn't survive. And it was a very scary experience, but I came back stronger, and I'm very thankful that I survived. I also gained a lot of knowledge, I gained a lot of medical knowledge on diseases like this. Back home, in many, not just my country, but many countries. Actually, I could give an example. Last year, someone in one of the Burmese villages, this person had similar symptoms as me, but coming from an underdeveloped country where medicine is not very developed, people didn't really know what was going on, and this person, he had similar symptoms as me, but no one knew it could be, encephalitis or something similar. So he went to an exorcist and he got beaten to death. So they thought it was, black magic, voodoo, something is possessing them. So he got beaten to death, and that's not the case. So I gained a lot of medical knowledge, and not just me, but my family, my friends, everyone who were with me in my journey. Everyone became more open-minded. Everyone was more aware, more conscious, and everyone, I guess, we all gained a lot of knowledge, and we're all very grateful to see someone like me experience and survive through something so.
We're very grateful that you could come here and meet us and show us how well you've recovered. I think everyone in the unit, all the nurses, all our team, we're all very excited to
We're
see
so
that you're doing so well.
We're so proud of you, Esther. We're really proud of you, and we can't wait to see all the wonderful things that you're gonna do. And we hope that you'll still stay in touch with us and tell us about you going back to school and all the amazing things that you're gonna accomplish.
Of course.
And we're very proud of you. Let's cure coma.
Yeah, thank you.